It really is a very great honour for me to be able to speak today about the remarkable man, Aubrey Sheiham, who gave so much to so many. And we've heard that word remarkable lots of times today, but I do repeat it, and with great depth. Without his teaching, I certainly would not have had the opportunity to undertake the roles that I have done in my career. But more importantly, dental public health would not have found such a voice in this country and achieved its current position in Public Health England. I have many memories of that route, but I'll take you through just a few. In 1983, I was halfway through a part-time master's degree in dental public health, working in clinical practice for the rest of the week. There was a change in the governance of the programme. Professor Aubrey Sheiham took over the course. The students didn't know him personally, but they'd heard a lot about him. What on earth was this going to mean for us? There was a certain amount of disgruntlement amongst us part-timers as he changed the curriculum completely. A whole new reading list arrived. I particularly remember the book Man Adapting by René Debow. It felt as though a hurricane had hit us. There was no room for complacency. This professor broadened the topic into a much greater context. We needed to think much further than the mouth. The social determinants of health were more prominent in our course than before. Seminars on food policy, barefoot doctors, and many other areas previously unconsidered by us were introduced to extend our knowledge. Tutorials became extremely challenging, sometimes adversarial, but always, always exciting and thought-provoking. He taught us to think and think again. Most importantly, not to accept the status quo. I was blissfully unaware at that time that I would one day become a Deputy Chief Dental Officer in England and latterly Director of Dental Public Health in England within the new organisation, Public Health England. Aubrey was definitely the catalyst that started me on that route and supported me along the way. And that support was not just academic, but personal too, as we've heard so many times today. When my brother died at the age of 45 from cancer, he was one of the very first people to write to me. There cannot be many of us working in dental public health in England who've not been touched or influenced and grown professionally and personally through contact with Aubrey, either by direct teaching or mentoring, by critical peer review, or specific challenge of our views and our research. Aubrey's commitment to the development of dental public health and those working within it didn't stop at his direct teaching responsibilities or his research and publications. He followed through, breaching the gap between academic and service people, not ensconcing himself in his ivory tower. His generosity of spirit is legendary, and we keep hearing that today. I personally, and others in dental public health, owe much to a group he fostered at UCL. We called ourselves the Bloomsbury Group. Membership of that group combined those working in academic public health and those in the wider service areas, trying to deliver at the coalface. These regular peer review and support meetings were a safe environment in which to share our views, develop and refine our projects, and also to look at our individual areas of work, appraise and learn from current research and define new research questions. In 2006, when the Department of Health asked me as President of BASCOD at the time to chair a working group to develop guidelines on prevention in primary dental care for England, at the forefront of my mind was Aubrey's teaching on the whole population approach, rather than high-risk initiatives. Combining this with a strong basis of evidence seemed to be an obvious way to theme that guidance. The members of the working group were wide-ranging and included Professor Richard Watt, who still remains on that group today. We published Delivering Better Oral Health first of all in 2007. It's now in its third edition. The first edition was adamant that fluoride varnish should be offered to all children, and that based on good evidence from a Cochrane systematic review. A practice population approach, not a high-risk approach, not offered on the basis of individual risk at all. This particular message was rather slow to be taken up by dentists. They didn't feel they were being paid to do it. However, the first edition did have a somewhat unexpected population effect. The guidance included both guidelines for interventions by the dental team and the preventive messages for patients. The most important of those possibly being around the use of fluoride toothpastes. We were quite clear about the evidence of efficacy for using toothpastes with a fluoride content of 1,000 parts per million or more, even in the youngest children. At that time, many of the children's toothpastes on the market contained only 500 parts per million in this country. The toothpaste manufacturers were made aware of our guidance, and the market responded. The toothpaste manufacturers suddenly started to produce children's toothpaste with 1,000 parts per million, so they were more evident on the shelves, easier for parents to buy as they saw them there in front of them. It's probably the biggest effect that I will have had in my career in terms of affecting the population of this country and their children. Thank you, Aubrey, for that population approach, which is probably having more effect than any of us could as individuals. Delivering the messages consistently in general dental practice about fluoride varnish, but more importantly, dietary advice on sugar reduction and what it can do for general health and oral health, still has a long way to go. The third edition of Delivering Better Oral Health is now out since July 2014. And that third edition, published by Public Health England, now has a chapter on behaviour change. Perhaps we need to change the behaviour of our dental teams, and it's more focused on them. But we certainly do need to change the behaviour of our patients and support them in what they can do to help themselves. More importantly, Delivering Better Oral Health is built into the care pathway being tested at the moment within the Dental Contract Reform Programme, and I look forward, Sara, to seeing the further developments of that. With the establishment of Public Health England in 2013, consultants in dental public health formally moved from the wider NHS into Public Health England. Links were also made with academic dental public health across the universities. This firm placement of dental public health within generic public health was the ideal opportunity for Aubrey. Although in his later years he approached it with the same energy and academic rigour as throughout his career. He forged relationships with key individuals, in particular Kevin Fenton, the Director of Health and Wellbeing, and Alison Tedstone, leading on nutrition. Aubrey's long-term involvement in the debate on sugar and his research and publications about sugar effects on oral health and general health gave him a wealth of knowledge to share during the development of recent policy papers from PHE. The October 2015 publication, Sugar Reduction, The Evidence for Action, and the accompanying suite of documents is having, and will continue to have, huge influence on sugar in the diet in this country, and he was fully involved in those conversations. I'm so pleased that Aubrey lived to see that published by Public Health England. So, all of us in this room, dental public health in England, me personally, we all owe a great deal, and I personally thank fate for changing the MSc programme to his leadership in 1983. Thank you.